Welcome to the Navigating Nursing School with Your Nursing Tutor podcast. Today, just like I promised last week, I'm going to tell you the 4 boring nursing school topics. Yes, I only say they're boring because you don't understand them yet. I think they're amazingly cool. But the 4 boring nursing school topics that you might think you understand, but you probably don't, and you have to know these foundational concepts in order to really not just understand topics in nursing school, but to be able to predict things like symptoms. So if you struggle with memorizing symptoms, if they kind of get mixed up in your spaghetti brain on your exams, stay tuned because I'm going to fix that for you today with these 4 boring topics. And spoiler alert, they have to do with fluids and electrolytes. Okay. So first of all, if you don't know me yet, my name is Nicole. I am a BSN RN and a professional nursing tutor with over 15 years experience tutoring nursing students. I love explaining this stuff to you like you're a 4th grader, not because you're dumb, but because it's just easier to understand that way. Am I right? Okay. I specialize in helping you learn how to think like a nurse. I'm not just about spoon feeding you information because that's not going to help you in the long term. What you really need is you need someone who can help you with how to think. And the way you change the way you think so that you can think like a nurse is by starting with the way you study. That's why I created the Silver Bullet study system, which is an easy to follow 4-step method that mimics the way experienced nurses think, so that you can practice thinking that way too during your study time. And if you're practicing thinking that way during your study time, that means you're going to have a much easier time thinking that way on your exams. And your exams are actually testing you, not on the content, they're testing you on how well you're thinking like a nurse. So you can see why the Silver Bullet study system might be useful. And at the end of this podcast episode, I will tell you how you can get a free 10-minute overview of my Silver Bullet study system for free. I know I just said that, but for free. So let's talk about the 4 boring topics in nursing school that you have to understand in order to really be able to predict symptoms of almost any disease process. Okay, I'm going to tell them to you, and then I'm going to back up and I'm going to tell you why they're so important. Okay, so osmosis, diffusion, oncotic pressure, and hydrostatic pressure. Osmosis, diffusion, oncotic pressure, and hydrostatic pressure. I'm sure you've heard of at least some of these terms before, okay? You might even think you know what they mean. They have to do with the way fluid moves in the body. And basically, for our purposes, fluid equals water, okay? More than water can be fluid, but I mean, water is the universal solvent in our world, and the human body is mostly made up of water. This is such an important thing because since such a large part of our body, more than half of our body, is made of H2O, therefore, understanding the different forces in the body that affect that water is going to tell us a lot about how our body responds to disease processes. And not only that, but how our body reacts under normal situations too, which is also important in nursing school. So let's think about real quick too, especially if you're in fundamentals. This can be really important. But if you're studying like changes across the lifespan, this is just one example of where really understanding the movement of water in the body can help, because when you're a baby, when you're working with babies, you have a higher percentage of like water to not water in your body. It's like somewhere roughly around 70% when you're a baby, an infant. And as you get older, you kind of dry out a little bit. So I hate rote memorization. So I always look for patterns and things and tell stories to try to make things easier to retain and understand. And so the way that I always remember the way I remember how fluid changes throughout the lifespan is when you're a little itty bitty baby. And I've got 6 kids, y'all. So I know little itty bitty babies. When you are a little itty bitty baby, you are juicy and squishy and just full of water. Okay. So cute. As you get older, you dry out. Adults, we're still pretty juicy, right? Not as juicy as the squishy little babies, but we're still pretty juicy. As you get older and later in life, you start drying out like an old prune, right? So, and that's why the elderly tend to have the smallest percentage of body weight of water. Okay. Now, this is important, and you'll see this as you go through nursing school, because a lot of disease processes and a lot of problems that you see in infants and the elderly, they're at higher risk for issues of fluid imbalance. So they're more likely to get dehydrated than adults or people in the middle of their lifespan. And this would make sense because they're at the far ends now of the fluid mass in their body. So like the babies, they're supposed to have a lot of extra fluid. If they lose some, that's going to make a much bigger difference in their body because their bodies need a higher percentage of water weight. Whereas in the elderly, they have lower levels of water in their body. So if they lose a little bit, that's going to make a much bigger difference because they're already dried out like old prunes. So now they're going to be even drier. And that can cause some big problems and put them at higher risk for issues and symptoms related to those things. Whereas you're in the middle of the lifespan, you're kind of like at an average amount of water in the body, you have more wiggle room. Last podcast episode, I talked about homeostasis. Make sure you go back and listen to that because that is, again, you can see it at work, just talking like this, talking about this topic. There's a certain amount of water in your body, and your body wants to maintain that percentage of water because that's how it maintains homeostasis. And so there's going to be different compensatory mechanisms that the body uses to help maintain that status. And 4 of the most common, there's a gajillion of them. Okay. That's an official term. Don't put that on your test questions, but there's officially a gajillion different ways that the body will try to maintain homeostasis with fluid balance, right? But the 4 most important ones that you run into nursing school the most, that will help you the most in nursing school, are osmosis, diffusion, oncotic pressure, and hydrostatic pressure. So let's talk about them a little bit. First of all, you want to be able to identify them and study them in isolation. Again, I mentioned this a little bit in the last week's podcast on homeostasis. We want to be able to identify them in isolation, because if we understand them and understand how the process works in isolation, then that's going to tell us a lot about its influence on the body and how it works in the body. But we can't only study it in isolation. Once we understand the individual process, then we have to kind of zoom out and do the mental gymnastics that's going to help us understand how those different concepts now work together in conjunction with each other to influence what happens in the body. So let's start with osmosis, because that's probably, osmosis and diffusion are really the 2 biggest players that you'll run into over and over again. And I find that the biggest problem I see in tutoring students that I work with, because I do, in case you're wondering, I do offer one-on-one tutoring. I also have a group tutoring membership, which is a great affordable way to get access to work with a professional nursing tutor. And honestly, that's all most people need. I know a lot of people think they need one-on-one tutoring, but honestly, my group tutoring membership is set up to give the majority of students exactly what you need at a good price point compared to one-on-one tutoring. And then I also have some self-study courses. So just throw that little commercial in there real quick. But anyway, the 2 biggest problems I see with students and understanding things like osmosis and diffusion is either you feel like you understand it because you've heard of it before, but you don't really understand it and you can't apply it. Or you have the definition memorized, but you haven't interpreted the definition. Whenever you're studying definitions, whenever you're studying anatomy and physiology and things like this is my advice to you. You have to know it well enough to be Miss Frizzle's substitute teacher. Do you know who Miss Frizzle is? Miss Frizzle is the cartoon teacher on the Magic School Bus, okay? And her job is to shrink 4th graders down to microscopic size, at least on the A and P episodes, and drive them through the human body, okay? As far as I'm concerned, those are the only Magic School Bus episodes that exist, are the ones that have to do with the human body, because they're my favorite. But my point is that she has to understand what's going on so that she can explain it to 4th graders. And that is such a great learning strategy, because if you are able to explain something in a way that you can explain it to a classroom full of 4th graders and take them on a guided tour, then that means not only do you actually understand it, but it means that someday when you are an amazing nurse and you have a very sick, scared, frightened patient in front of you who wants to understand what's going on with their body, you're going to be able to explain it to them in terms that they can understand, because they don't know all the medical jargon. And if you just word vomit that medical jargon to them, it's going to make them feel dumb. They might head bob and say they understand, but they don't. They don't. And they're just left feeling even more scared and sad. But if you're able to sit there with them and explain it to them in terms that they can understand, they are going to remember you forever as that amazing angel nurse who took the time to explain to them what was going on in terms they could understand. And I know that's the kind of nurse you want to be. So it is worth your time to study things this way now, both for your exams, because trust me, it is going to help you for your exams to do it this way. It's why I teach students to do it this way. But it's also going to help you long-term in your nursing career to make you a better nurse. So what is the definition of osmosis? Again, there's the formal definition. I'm not even going to tell you the formal definition. You can look that up on Google. I'm going to tell you my definition, okay, in my own words. Always put definitions in your own words. Osmosis is the movement of water across a semi-permeable membrane to try to dilute stuff. Okay, do you see all those like high-tech words like stuff in there? So stuff is like all the particles, like the electrolytes and basically anything that is not water. And so osmosis requires three things. It requires water, because that's the thing that's doing the moving. It requires a semi-permeable membrane. You might remember that from chemistry. A semi-permeable membrane is basically, think of it like a wall that allows some things through, but not everything. Now, obviously, it has to allow water through, or else the water's not going to be moving anywhere. But think it, you have to have a semi-permeable membrane with osmosis, because if you just think about a cup of water, if you pour water into that cup, where's the water going to go? It's just going to be sitting in the cup, okay? Based on the forces of gravity. It can't go anywhere. It just is, because water, liquid, the properties of liquid, it just fills the cup. But if there is a semi-permeable membrane put down the center of that cup, and you may have seen a diagram in this in your PowerPoint slides or your textbook, if there's a semi-permeable membrane put in the center of that cup, now there's two sides. The water can be on one side of the membrane, or it can be on the other side of the membrane. And depending on how much stuff, that's the third thing that's required for osmosis. So water, a semi-permeable membrane, and stuff. Depending on how much stuff there is on either side of the membrane is going to influence how the water moves. So if we have a semi-permeable membrane that allows water to move through, but does not allow, say, sodium, okay, Na, doesn't allow sodium to go through, and we put a lot of sodium on one side of the membrane, and we just put a little bit of sodium on the other side, well, we have more stuff on one side of the membrane and less stuff on the other side. The water, because of osmosis, the water wants to dilute the stuff. It wants to dilute it so that the stuff can be spread out as evenly as possible. So the water is going to want to move from the side where there's a little bit of stuff and go over to the side where there's a lot of stuff. Now, is all of the water going to move over there? No, because there's still some stuff over here. So some of the water wants to stay here because of osmosis. It wants to dilute the small amount of stuff over here. But some of the water is going to move over to the other side because it wants to dilute the large amount of stuff over there too. And you've probably seen pictures like this. You can Google it if you need to. But what you'll end up having is one side of the membrane has a lower water level now than the other side of the membrane. And so you'll end up with more water on one side of the membrane and less water on the other side of the membrane. But it's about a ratio. Think about it like a fraction, a ratio, right? If you were to take out a sample of the water and count how much stuff was in that amount of water, the ratio on both sides of the membrane would be the same now. So there's more water on this side, but there's also more stuff. And there's less water on this side, but there's also less stuff. And because of osmosis, it's trying to even out the ratio so that the ratio of stuff to water is the same on both sides. Okay, so that's osmosis. Now, diffusion sometimes gets confused with osmosis when students don't fully understand it. That's why I was being very clear that osmosis requires 3 things: water, semi-permeable membrane, and the stuff. Okay. Diffusion, it only requires the stuff. Okay. Diffusion only requires the stuff. Now, when we are talking about the human body, the diffusion is usually happening in water because, as we talked about at the beginning, our body is mostly water. Okay. So almost everything that happens in the body is happening in the context of water. But diffusion as a concept can happen without water. I'll give you an example that's really gross. And if you've never heard this before, you will never forget it. And you will be cursing my name forever after you hear this example. But it's okay because you won't forget it. Diffusion can happen in the air. So think about this. If you're walking down the street and all of a sudden you smell dog poop, do you know what that means? That means that there's a solid hunk of dog poop somewhere nearby, and some of the molecules from the surface of that solid piece of dog poop diffused into the air. Because when something's a solid, it's an area of high concentration. There's a lot of dog poop molecules in that pile of dog poop. And it's diffusing to an area of low concentration. Because diffusion, I think I forgot to tell you the definition. Diffusion is the movement of stuff so that it spreads out as evenly as possible. Okay, it's the diffusion is the movement of stuff, particles, molecules, whatever, so that it spreads out as evenly as possible. So if we have a solid pile of dog poop, and then of course the air around it, there's no dog poop there. So some of the molecules on the surface of the dog poop diffuse away out into the air, float around, they get to your nose. So yes, every time you smell dog poop, remember this from now on, you have dog poop in your nose. That's how you smell it. If you go back to anatomy and physiology and review your olfactory senses, your sense of smell, that dog poop molecule has to connect to the sensory neurons that signal to your brain what it is that you're smelling. So you are welcome. You're welcome for that little piece of knowledge that you will never forget now. That you have dog poop in your nose every time you smell dog poop. But it's because of diffusion. Okay. I could have used a nice analogy like baking cookies. You know, you walk into a room and you smell the smell of baking cookies. It's the same thing, same concept. Okay. Now, in the body, it happens in water a lot of times. This is why lab tests work. Have you ever thought about that? Like, why is it that you can draw some blood from somebody's arm and then make assumptions about how many electrolytes they have in their entire body? It's because those electrolytes, they spread out evenly throughout the blood. Blood is mostly water. If you don't know what blood is, think about this. I talked to a tutoring student about this the other day, one of my one-on-one tutoring students, because I realized there's a lot of things in nursing school where before nursing school, especially if you don't have any healthcare experience, we use vocabulary one way, a kind of a casual way. But then when you get to nursing school, sometimes vocabulary is, it's more formalized, like it has a very specific meaning. And so when we talk about blood, casually, we might mean like when you cut yourself and you bleed, or you might mean like red blood cells specifically. But when we talk about blood in the medical context, it's very specific. It's not red blood cells by themselves. Red blood cells are only one component of blood. There's also white blood cells. There's plasma, right? Plasma is actually what makes up the majority of blood, and plasma is mostly water. So water makes up the majority of plasma. So most of our blood, what we think of as blood, is actually water. And that's because water is the universal solvent. It dissolves almost anything. Life on this planet could not exist without water. It's amazing. So we have the, things that are dissolved in the water. If you're studying fluids and electrolytes, let's talk about electrolytes. Sodium is the most common electrolyte that is dissolved in the blood. And if you just take a sample of blood, because of diffusion, because sodium wants to spread out as evenly as possible throughout the blood, then when you take a small sample of blood, you can measure how much sodium is in that small amount of blood. You can take a ratio. And that tells you approximately how much sodium you have in the entire body. So you can know if a person is in homeostasis related to their sodium levels based on taking a small sample of blood. Isn't that amazing? Like, here's another analogy for you about diffusion. Think about, like, there's a party in a big ballroom, right? Like 100 people come. And if everybody, all 100 people just crowded into the corner of the ballroom and hung out there, that would be really weird. Okay, that would be really weird, wouldn't it? That would be very uncomfortable for everybody. What are they going to do instead? Those 100 people, they're not going to crowd into the same corner. They're going to spread out. They're going to generally diffuse through that large empty room so that they're roughly equidistant. Are they going to be, is everybody going to be exactly at arm's length? No, of course not. Remember, if you remember my, again, homeostasis podcast from last week, it's like that driving analogy. You're always making little adjustments. It's never going to be like perfect, but everybody's kind of milling around. And generally speaking, everybody's going to be evenly distributed throughout that ballroom because they're diffusing through the ballroom. And so that's why we can make educated guesses about how much sodium is in the entire body by taking a small sample of blood because of diffusion. Now, diffusion and osmosis work together, okay? Because as you can imagine, let's go with the sodium, continuing with the sodium explanation, as sodium diffuses around the body, water wants to dilute it. So diffusion can happen, and then that affects the osmosis because now osmosis wants to behave a little differently. And once osmosis has come and kind of allowed the sodium to spread out even more, well, now diffusion, that might adjust diffusion. And now we have our steering wheel analogy. Both of them, osmosis and diffusion, are working together to make these small little micro changes in fluid shifts in our body. Now, understanding osmosis and diffusion alone, and this is even going a little bit long, so I think I'm going to split this up and I'm going to talk about oncotic pressure and hydrostatic pressure in my next podcast episode. But in terms of osmosis and diffusion, how can this help you with nursing school? It can help you predict symptoms about, kidney issues, right? It can help you predict urination. It helps explain urination. Urine is just filtered blood, and you can't urinate without osmosis and diffusion. Isn't that cool? It'll help you explain, obviously, electrolyte imbalances and some of the symptoms that you would see with them. It'll also help you with a lot of endocrine disorders, diabetes insipidus, syndrome of inappropriate antidiuretic hormone. It'll help you understand edema, first, second, and third spacing. All kinds of things that are these are symptoms, these are outcomes that you're not only just going to understand, but you're going to begin to predict when and how and why they happen when you actually understand osmosis and diffusion first. That's why the first step of my silver bullet study system is about what is normal. The question you ask yourself is, what do I need to know about normal before I can begin to study the topic that I need to understand? And I'll give you a spoiler for step one, because I'll tell you how to get the free 10-minute video. But step one is going to be you spend 15 to 30 minutes reviewing normal, because you have to understand normal, just like you have to understand osmosis and diffusion. That's part of step one of the silver bullet study system for so many topics in nursing school, almost every single disease process. And once you know it, guess what? It doesn't change by your last semester. So this is going to make nursing school easier instead of harder as you go when you set a good foundation. So how can you get that free 10-minute video on my silver bullet study system? Just go to my website at www.yournursingtutor.com/SBSS. That's SBSS. It stands for Silver Bullet Study System. So yournursingtutor.com/SBSS. Fill out the form and I will email you the link to that free 10-minute Silver Bullet Study System overview and a PDF download with the 4 steps. So that's all for today. I would really greatly appreciate it if you would go to Apple Podcast and leave me a 5-star review if you enjoyed this podcast. You can also let me know if there's any topics you'd like to know in the future. or what you've gotten out of this podcast and where you're at on your nursing school journey. I love to hear from you. And in the meantime, good luck on your nursing school journey.